Gout is a medical condition characterized by attacks of inflammatory arthritis. The joint at the base of the big toe is the most common affected area. Gout has increased in recent decades, affecting 2% of the Western population at some point in their lives. Gout was historically referred to as the king of diseases or the rich man's disease. Gout can be presented in a number of ways. Symptoms consist of red, hot, tender, swollen joints. Joint pain begins over a 2 to 4 hour period during the night, and the reason it happens at night is due to the low body temperature. Other joints, such as the knees, heels, wrists, fingers, or ears, can also be affected. Dietary causes account for about 12% of gout and include the consumption of alcohol, fructose-sweetened drinks, meats, and seafood. A way to decrease the risk of gout is to consume coffee, vitamin C, and dairy products, and physical fitness also helps. The occurrence of gout is partly genetic. Gout also happens to be a medical condition associated with the diseases of obesity, insulin resistance, lead poisoning, paralysis, and organ transplants.
Gout can be diagnosed through blood tests and x-rays. Blood tests that are commonly performed consist of a white blood cell count, electrolytes, and renal functions. X-rays, while useful for identifying chronic gout, have little use for acute attacks. The initial aim of treatment is to stop the symptoms of severe attacks. Ongoing attacks can be prevented by different drugs used to reduce uric acid levels. Ice applied for 20 to 30 minutes several times a day decrease the pain. Many medications can be used to cure the disease of gout, but steroids are the most common. Without treatment, gout will usually resolve itself in 5 to 7 days. However, 60% of people will have a second attack within 1 year. In other animals, gout is very rare because they produce uricase, which breaks down uric acid. Unfortunately, apes and humans don't have this ability, thus gout is very common.
There is a type of arthritis called gout that has had a long and interesting history. In fact, it was once known as the disease of the rich.
It seems that there was an epidemic of gout in England at around about the time of the 17th century. Many of the important risk factors for gout were most prevalent in that stratum of society, namely alcohol drinking.
Bruce Faubert is a 53-year-old salesman, and like all gout sufferers throughout history, his illness began in the kidneys.
What often happened in Europe a few hundred years ago was that the royalty had, or the wealthy had access to port and other wines that happened to have been made in containers that contained lead. And it turns out that lead can damage the kidneys, causing you to retain uric acid.
Uric acid is usually excreted from the body in the urine. But for reasons not completely understood by scientists, gout sufferers retain too much in their body. The excess uric acid is carried by the bloodstream throughout the body and settles in the joints, usually the foot or big toe. There it forms into microscopic needle-like crystals that inflame the joint and cause severe pain. The buildup generally occurs slowly over time. But once enough uric acid has collected, a gout attack usually happens very quickly.
It comes on suddenly, so patients sometimes go to bed feeling well and they wake up in the middle of the night or in the morning with a red, hot, swollen, painful, big toe.
The night that I finally really got gout is I woke up and my foot was throbbing. It was like a toothache. I had to take the covers off it. The actual covers hurt the foot. I couldn't put the foot down on the floor. I kind of had to hobble around, and even that was sore because your whole foot's swollen and red. It feels like somebody actually hit your foot with a sledgehammer. That's how bad it is. And I thought I broke it, but I didn't know what I did to break it.
Bruce visited Dr. Robert Yood at the Fallon Clinic in Worcester, Massachusetts. He presented with classic gout symptoms. To confirm the diagnosis, Dr. Yood performed a test that very easily diagnoses the disease, removing fluid from the affected joint.
Far and away the best and most reliable way to diagnose gout is to drain some fluid and look at it under the microscope, because you can see the sodium urate or uric acid crystals under the microscope and make an absolutely definitive diagnosis of gout.
Gout affects 2.4 million Americans. Although it can't be cured, it is the most treatable form of arthritis.
Well, when I have an attack coming on now, I actually get a little soreness in my big toe, but if I start taking my medication, it normally knocks it right out and I'm fine.